Hi, everybody. Thank you and welcome. I am Shari Dermer, the Senior Director of Clinical Strategy at Medscape Education, and I am pleased to be joined in a conversation with Michael Betel, the President and Founder of the Fatty Liver Alliance, on today, International NASH Day, NASH, non-alcoholic steatohepatitis. And we're going to have a conversation about why we need to raise awareness around this disease. So, Michael, thank you so much for joining me.
Hi, Sherry. Thank you for having me.
So, can we just jump right in and start on the questions?
Of course.
Okay. So, what is the importance of having an International NASH Day?
This is a really great example of how the world can work together for a common good, in this case, about liver health. And when you think about all the awareness that COVID got as an epidemic, and look at the epidemic that we have with liver disease and NAFLD and NASH, there is a big disparity in the amount of people that are even aware of it. So we're looking at, between 25 and 40% of us having fatty liver disease, and probably about a quarter of those having NASH. So it's a very serious
That's a
situation.
staggering number. It really is. Um, and so, I guess my next question is, what does this mean for patients in terms of their burden and mean for their families?
Okay, so that's the scary part. You do see people talk about NAFLD and NASH and that it's a silent disease. And if you try to determine what that means, that for most people, back to when this condition starts, fatty liver can be benign for a lot of people, and it has no impact on their life except for the liver itself. Kind of, that there's an issue when they're tested. But the problem is, as it develops and the liver gets stiffer and there starts to be inflammation and spring, it changes into NASH. NASH still, believe it or not, because the liver is an amazing organ, it still is a silent disease for most people. So interestingly enough, a lot of people will say, and there starts to be inflammation and spring, it changes into NASH. NASH still, believe it or not, because the liver is an amazing organ, it still is a silent disease for most people. So interestingly enough, a lot of people will say, I mean, they didn't know that they had liver disease, but I've been feeling kind of tired lately. They call it a brain fog, but they don't really assign that to a liver disease, and it's really often just found because of liver tests that they happen to be doing at their primary care physician.
And so, does that mean that there are plenty of people who are walking around who have absolutely no idea that what they're feeling is related to NAFLD or NASH?
Yes, I just heard a presentation by Dr. Naeem El Khoury at Arizona Liver Health, who said in their research, 68% of the people that presented at their clinic with an advanced liver disease didn't even know that they had it.
Wow, that's amazing. So I guess my next question is, as somebody who is the lead in an advocacy organization, what is the role of advocacy organizations in education surrounding NASH?
Well, so I'm going to answer that and expand a little bit on your first question at the same time. I think the reasons that we have International NASH Day, and I want to give a shout out to the Global Liver Institute for all the work that they do to promote it and how successful it's been, especially this year. But it's about five things, and it's the same answer to what you just asked me. It's about raising awareness. So again, that the incidence is really, really high, yet politicians almost never talk about the liver, like at those parliament sessions. NASH, it's especially NASH is unknown. It's hard for people to even pronounce, let alone understand what it is. And so this is a day that's dedicated to raising awareness about the disease and its causes and its complications. The second thing is that we have an opportunity to promote prevention and healthy living. So patients who don't understand that, the recommendation is 30 minutes a day for at least 5 days a week. So that's 150 minutes of exercise and healthier eating. So that would be like less carbs, less sugar, ideally a Mediterranean diet type of food choices for people. Not possible for everybody, but that's the ideal. And that healthy living. The third area is with regard to patients and the benefit to patients and physicians is to we could all advocate for more research and treatment. And so when we have opportunities like the FDA meeting that happened a week and a half or so ago, and there was ICER as well, that the patient advocate groups have a chance, thankfully, to express our opinions about how important treatments are for patients, and that it is a disease that progresses and it is serious and people are needing a transplant and dying. So the research into both treatment and care are really important. The fourth area is about supporting people who already have NASH, who don't know they have it, and that's why we try to promote early assessment and testing, so that we can talk about that in a bit, but so that more and more people find out that they have this disease. And lastly, it's what we started with about the International NASH Day, that it's about global recognition of NASH and liver disease. And even though, ironically, it's probably the center of many interorgan issues, it's not recognized that way, and so it doesn't get that awareness that other organs get.
Right. Absolutely. I mean, we're all pretty much aware now of the obesity epidemic, and I think that this, NASH, NAFLD are going hand in hand with it. So it really does behoove us all to become more educated about that relationship. So, I mean, I know you've now mentioned several things that the Fatty Liver Alliance has done to promote greater disease awareness, but I know that you've done more. And what else have you been doing, not just today for International NASH Day, but, in the last year or so?
Well, every day, that includes weekends for those who actually log in online, because I'm a little addicted to the whole process of sharing information and knowledge transfer. But every day we post information about NAFLD and NASH. Sometimes it's about sharing new research that's been done by investigators around the world. Sometimes we do fireside chats where there are key opinion leaders internationally that have either published or have important messages to share from their research or their experience, and we post those as well. And we're doing more in the community. I know you said specifically not necessarily about International NASH Day, but we are getting more into the community, and also trying to facilitate conversations and interactions between multidisciplinary caregivers. So primary care physicians and the endocrinologists and the hepatologists all talking and trying to come up with clinical care pathways that they can agree upon so that they can work together for the benefit of patients. And so that's something that we work on. Last December, we had the first annual Primary Care NAFLD and NASH Summit. This year it's on December the 7th, and we're focused on primary care as the first line people that are coming in contact with patients. So that's a few things. But
Absolutely. And you said something about knowledge transfer. And so, Medscape Education, as the education part of our name applies, knowledge transfer is really central to what it is that we do. What do you see as some of the gaps in education for clinicians who are treating NASH?
right. Well, which is a really great question, because I think that we need to get to the point where, and it's really all physicians, but let's start with primary care. When patients come into primary care, ideally it would be a proactive approach. Maybe there's a medical records that have already looked at historically a patient's, lab test, for example, or they've been, following year over year the weights of patients or the BMI, and or the waist circumference. You can actually flag to the physician, who has a million things to talk about with the patient and a very limited amount of time, that they would actually seek out the liver health of the patient and talk to them about getting assessed if they're at risk. Like you said before, type 2 diabetes, obesity, sleep apnea, high cholesterol are just a few of those risk factors. So in that perfect world, physicians should be looking at or recognizing patients who are at risk and then assessing them.
Absolutely. And what about patients? How can education better support the needs of the patients?
Well, so patients have to realize that physicians are very busy and have a lot of other issues that they're focusing on, especially, even with all of our health, we all have different issues. And so the liver isn't top of mind. And so if a patient knows that they have over a 90% chance of having fatty liver disease and another 25%, let's say, of having NASH, they should say to their doctor at their next visit, by the way, I heard that because I have obesity and type 2 diabetes, let alone the other risk factors that we just discussed, that I'm at risk and I would like to be assessed for liver disease. That would make a big difference.
So proactive patients.
That it has to be both sides. It's got to be the patients asking for it, and it has to be the physicians looking for it.
Right. And I mean, we all know that, exercise, lifestyle, as you were mentioning, the Mediterranean diet right now are pretty much top line for managing NASH. And we know that the climate is changing in terms of having potential therapies somewhere in the near future. How can we, ensure that patients are aware of those new treatments, have access to those new treatments when they do become available?
It comes down to, I think, physicians letting people know when they do identify people at risk to say that new drugs are on the horizon. And you know what? It would be great if you could actually start working on the things you can control now, because when you are treated, you're still going to need to continue with those lifestyle modifications. So you're still going to need to do exercise. You're still going to need to watch what you're eating. The drugs that are going to come out are not really a long-term cure if the patients go back to eating the way that they were eating and then they stop taking the medication. So this is a lifetime move. People have to take care of their health.
Absolutely. I mean, it is a chronic condition, and I think that reframing it in that perspective will definitely help patients understand that it's akin to having, for example, type 2 diabetes or hypertension. You go off the medicines and you lose the benefit of all the good things that you've done. So how can we know that the recent clinical guidelines, so several of the medical societies have actually published clinical guidelines on identifying at-risk patients. What can we do to make sure that that's being translated into practice?
Well, we as in your organization, Medscape, or we as in the
I
physicians
think we, as in an educational a company, as
forum.
and
Yeah.
and an advocacy organization as well.
Yes. So the ASLD guidance statements that came out are definitely an excellent guide for physicians specifically to understand what it's going to take to address these issues with patients, like with regard to lifestyle, with regard to risk. It also covers a lot of evaluations, testing, FIB4, FibroScan, all of those things people need to know. So we have to continue to share that. Fatty Liver Alliance had two interviews that were online with the co-authors of that document, and we shared a discussion about that. So it's just about talking about it, because otherwise it's going to end up with just being on somebody's desk. So it has to be a living, breathing document.
Yep, I could not agree with you more, Michael. And I want to thank you so much for having this conversation with me. It was an absolute pleasure. And thank you to everyone who has tuned in to listen to this. And let's make sure that everything that we're thinking about today is kind of carried through for the next 365 days so that we can keep this awareness high and front and center.
And fattyliver.ca, plug for the day.
Absolutely.
So thank you.
Thank you, Michael.
There's a lot of information there to share too. So thank you for having me.
You are very welcome. Bye bye.
Bye.